or of not wanting to get better. The therapist may experience this as passive-aggressive behavior or as a sabotaging attack on the therapy. It will take deeply compassionate insight for the therapist to realize that the client has so few resources that they cannot afford to risk losing any, and therefore change has to be negotiated in tiny steps and at a snail's pace. In the course of therapy, it will gradually emerge that this client suffers from early emotional neglect. I have come to call these clients ignored children because their history is typically one of being ignored by their caregivers as infants or young children. They may not have been rejected or abused early in their lives, but they were not made to feel welcome, loved, and safe in the world either, and they didn't have their needs met or even seen. Instead, they were taken for granted, overlooked, treated like adults from a very young age, or used by their caregivers to help without receiving any positive attention in return. What I call emotional neglect is specifically the experience in the first months and years of life up to age about 6 years of not feeling welcomed, not being seen as a separate person, and not having one's needs met or even perceived by caregivers. In the life of an emotionally neglected child, there is no adult caregiver who is reliably available when the child needs an adult. There is no caregiver to show the child that their presence gives the caregiver joy, no caregiver to look after the child and keep them safe, and no adult caregiver for the child to reach out to for help and support. Instead, ignored children are on their own and have to look after themselves. Indeed, often they have to parent not only themselves, but also their parents. In recent years, psychotherapists have learned an enormous amount about abuse in early life and how this affects its victims in later life. Often, people who have been neglected are bracketed in with abused people by mental health professionals. But a person with a history of being neglected is different from a person with a history of being abused. Although both a neglected and an abused person are traumatized, the nature of the traumatization of the neglected person is characteristic and distinct from that of an abuse victim. I will elucidate the main characteristics of clients with a history of early emotional neglect in the following chapters. The main consequence of emotional neglect is that the person will grow up with developmental deficits. This means that the person will be rather like a child trying to live the life of an adult person. They are constantly overstretched, overreaching themselves, having to run to keep up. The traumatization of a neglected person is therefore akin to burnout because it results from having to do too much with too few resources. As a consequence, the cultivation of new resources in therapy will be of central importance. In clinical practice, we also find that developmental deficits make it extremely difficult to change because the scarcity of resources means that a person cannot ever risk losing anything that contributes to their habitual functioning. Because of this, psychotherapy with clients who have been emotionally neglected is very slow, and change can only happen in very small increments and by the addition of new resources that don't constitute a threat to old ones. Other main consequences of early emotional neglect are the experiences of feeling ignored, unwanted, and uncared for. Being ignored is likely to lead to powerful anxiety because for a very small child, it is dangerous to be ignored. Feeling unwanted will almost certainly lead to pervasive and toxic shame. Both the anxiety and the shame will be generalized and persistent in adults who were ignored children, and it will not be easily possible to trace them to specific conflicts within the person. The experience of being unparented and uncared for will create a person who often feels bewildered by life, as if they had not been taught how to do life. This in turn may make situations involving some expression of spontaneity, such as making a choice or being